Now, the next module is how do we reduce the risk associated with physical intervention? In the previous lessons, we identified that there are risks that comes with the use of physical intervention. Now, how do we reduce this risk? Risk assessment? Lovesa?
Yes.
How do we reduce the risk?
So you find that different, you try different techniques rather than physical intervention.
You try, so I should keep trying different techniques until I get the right one?
No, you should try to de-escalate.
Should this escalate? Yeah? Rather than using the force.
Yeah.
Okay? Nikki, what do you think?
Conflict management skill, good communication skill.
Yes, that is when you try to avoid it. Now, in this situation, we know there's a risk when we use force. How do we now? So we don't have any choice now. We're using the physical intervention as a last resort. How do we reduce the risk?
Effective communication.
Effective communication. The first thing he mentioned, risk assessment. If you work in an area where you have customers coming to give problem, customers, most of them, they are on drugs or they take a lot of alcohol. Yes? It is the duty and responsibility of the owner of the venue to carry out a risk assessment. Now, after the risk assessment, a control measure needs to be put in place because it's now a must that we must use it. Right? Because it's the last resort. Right? Then, we need to make sure that whoever that is going to use the physical intervention is properly trained and follow the guidance. And that's why you are in this class. Are you getting it?
Yeah.
So this course will train you what techniques you can use and how you are going to be able to use it properly. Like I mentioned, this course is not training you to be a martial art individual. We're not fighting war here. We are just security operatives. And we are working under the law. We are guided by law. Licensing Act 2003 is there. Section 3 Criminal Act is there. 1967. And many more. So we need to use it within those framework. All right? So, for you to take one on the ground, what we are saying here is that you should avoid taking any subject to the ground. You should avoid it. But where you cannot avoid it, there are things you need to put in place. You need to consider those things we have identified as situational factors and individual factors, right? You want to know the appropriate techniques to use. And also, how long are you going to use these techniques? Do you agree with me? The environment. Do you have debris there? Do you have broken bottles? Is the person you are restraining, does he have families or friends around? Assuming we're all friends and we decide to go to the club and one of us is being restrained, are we going to fold our arms? And we think the officer is not justified to have done that. Are we going to fold our hands? We're all going to attack him, right? So these are things. And you also get someone who is going to be one of your colleagues to also monitor the person, maintain communication, to make sure the person is not complaining about anything, such as pain or difficulty in breathing, which was the case of George Floyd. Anything that can compromise your breathing can lead to positional asphyxia, and it's a medical emergency. So we need to be very careful, right? So part of what we need to do is we need to get them up as soon as possible. You de-escalate as soon as possible. All right? Dealing with physical intervention incidents on the ground appropriately. This is going to answer question 8. Identify ways of reducing the risk of harm to a person when physical intervention techniques are being used. Use more than one door supervisor, so that while you are on ground, while you're on ground with the subject, another person is monitoring the environment. Another person is monitoring the subject, whether it's complaining, whether it's responding, whether the breathing is being compromised. You need to maintain dialogue, and you try to de-escalate as soon as possible. Right?
Answer number 8, right?
Yes. That is the response to question 8. The ways to reduce the risk of harm when physical intervention is being used on the ground. Any question, please? And in case you spot any sign that we have mentioned, such as ABD and psychosis, what do? You cease restrain. You cease restrain. Any question? What are the types of harms on the ground, guys? If you restrain one on the ground, what are the types of harm?
It changes color, it can stop breathing.
It can stop breathing.
Stress.
That could be serious injury. when you restrain one on the ground. Right? When you're restraining one, you are not expected to kick them. Restrain one on the ground, facing down or facing up. Holding people in a situation that involves their neck or the spines or any vital organs is dangerous. Those can lead to death immediately. So we shouldn't do that, guys. Any forceful restraint, like that of George Floyd, you should not do it. And going back to the question asked by Musa, you must respect the dignity of the individuals you are managing, however challenging you may find them. You must respect their dignity at all times. Musa, that answer your question? Anybody doing otherwise is working out of the rights that we have under the law to use minimal force. Okay? How do you reduce the risk of harm? These are all other options. Choose the least forceful intervention. Avoid high-risk position. This also answers the question in number 8. Yes, how do you reduce the risk? You maintain ongoing communication and monitor the well-being of the subject. You work as a team.
Okay, go back, please.
Yes, work as a team and follow procedures. De-escalate. This was in previous slides. De-escalate at the earliest opportunity and immediately release and provide support. Any question? Risk assessment. The continuous assessment of risk in the rapidly changing circumstances in the workplace or during an incident in order to implement the control measure necessary to improve safety. Anytime you find yourself using physical intervention, you are expected to carry out dynamic risk assessment. Dynamic in the sense that it is continuous. And you need to do this before the use of the physical intervention techniques. You need to use it. You need to carry out the dynamic risk assessment again during and after. Because when you started using it, it might just be you and the subject and your colleague around you, which you consider safe. But other threats can come around, like the friends, families, good Samaritans, people who just look at you and say, why are you treating this person this way? Why are you doing that to that person? And you yourself become a target. So we need to carry out the risk assessment before, during, and after. All right? And that leads us to what you have studied in your conflict management module when we are talking of TACT, T-A-C-T. Think safety first. Remember I told you your safety come first, right? Think first, safety first, assess the situation, consider your options, right? And take action. You need to do all this first. Think of safety, assess the situation, is it safe? Consider your options. What options can I take? Do I use this de-escalation techniques? Do I need to use the physical intervention skills before you take your action? Also, you need to consider the subject involved, the person involved. How old is this person? Is he a young person? Is he a child? Is he an older adult? The environment. Is it a wet floor? Do you have debris on the floor? Do you have broken bottles? All this you need to consider. Is there any weapon involved? Somebody is holding a gun. And you are not holding anything. And you want to restrain such person. Do you think you're going to go free?
You're gonna die.
No. So you need to carry out dynamic risk assessment. What are the benefits, guys?
Saves your life.
We will go to the benefits of the risk assessment. Carrying out dynamic risk assessment.
So you missed number 10.
Hold on. When you carry out a dynamic risk assessment, it allows you to be able to determine which techniques to use. How long do you have to keep the subject? Yes? It allows you, that should be number 9.
What was it? Say
It
that.
allows you to identify the threats, the method or the techniques to use.
Identify the tracks.
Come again?
The tracks.
The threats.
What is next?
Threats.
The threats.
The techniques to use. How long do you have to use the techniques? Those are the benefits.
What about continuous thinking, continuous using of risk assessment, thinking safe, subject, environment, weapons?
What did you say?
We are on number 9, so I was just saying that what are the benefits of a dynamic risk assessment?
Yes.
And I said continuous using of risk assessment. Continuous using of risk assessment.
No, that's not the benefit. What it's asking is, what do you gain
Okay.
by carrying out a dynamic risk assessment? All the ones 3 or 4 I have mentioned are the response. It helps you to identify the threats. It helps you to know the method, the techniques to use. How long do you have to use it for? All right?
Yeah.
Now, safety during physical intervention. This can be done by fully observing the risk factors, the situational and the individual. Ensuring that nothing impedes the subject's circulation or ability to breathe. Make sure their airways is not blocked. Make sure they are breathing. And nothing impedes their circulation. Because all this, when they happen, it becomes a medical emergency. That is one of the reasons why you need to have a first aid before doing this course. If somebody is conscious and is breathing, or somebody is unconscious and is breathing, what do you do to that person? Recovery position. And when they are not breathing,
CPR.
and when they are not conscious, what do you do?
CPR.
You need anything from office? Yeah? You will not
CPR.
okay.
Do you see the relationship between them now?
Yeah.
Why you need to have knowledge of first aid before doing this course. All right? Any question? When you see all these signs, which are red flags, 6, restrain.